If home is where the heart is, then Josie Chavira has certainly found hers.
I love what I do, and I love the patient care that I give to the patients.
For the last 10 years, Josie has worked at South Texas Health System ER Weslaco, performing thousands of potentially life-saving mammograms on women from the Mid-Valley and beyond who appreciate the facility's close-to-home convenience.
They like the fact that they don't have to drive at a distance to see where the facility's at, because we're right off of the expressway. They like the convenience that there's when they come up front and walk in the outpatient waiting area, that the delay is not that long and that everything is so close. They don't have to walk so far.
Beloved by patients, Josie, who has worked as a registered mammography technologist for nearly 30 years, was hired in November 2014 to help launch the mammography program at STHS ER Weslaco, 2 months before the facility's grand opening.
It was just a nice building with things that were lacking. I didn't have cabinets, so those had to be ordered. They had to place an order for the engineer to come and install them.
Along with setting up her workspaces, Josie had to build community awareness of the mammography services at STHS ER Weslaco.
I took it upon myself that I started going out to the doctor's offices and let him know that we had mammography in this new ER here in Weslaco. And I would be dropping even the pamphlets as far as for orders for them to see what we provided here, the services we provided.
10 years later, Josie's volumes have increased well beyond the 3 mammograms a day or so she first saw when STHS ER Weslaco opened.
I look at my schedule and I have like 13 patients a day. And then if you look at every day as through the week, how many I have, or even for next week, for next month, and you know what? My schedule is full.
To date, STHS ER Weslaco has performed more than 10,000 mammograms and counting, with Josie's calm, communicative, and supportive demeanor credited for a large number of repeat patients.
They started coming here ever since we opened, and they've been here every year. They said, "Oh, don't ever leave because we're so used to you."
Like Josie, Eddie Arevalo helped launch STHS ER Weslaco, where he continues to perform inpatient and outpatient ultrasound services. The Donna native, who has worked at South Texas Health System on and off since 2002, still recalls the excitement surrounding the opening of STHS's first freestanding emergency department like it was yesterday.
Knowing that we were coming from the ground up, building something, kind of gave you that more sense of pride. You knew you were laying the foundation for the future, because this was going to build, and I knew more FEDs were coming down the line.
Since day one, Eddie, the lead vascular ultrasound technologist responsible for the sonography services across STHS's 7 freestanding emergency departments, knew that despite any initial confusion about the facility's capabilities, STHS ER Weslaco would have a positive impact on the community.
In the beginning, you had to kind of educate the people and let them know that, we offer all the services here that a regular hospital does, and we are connected to a bigger hospital. We were started off a little bit slow, but then it started picking up and people started getting the word out. People started noticing that this was a good alternative, a better alternative to what was available at the time. The fact that we keep growing shows that, it is having a positive impact, and we are doing a good thing.
Beyond the more than 18,000 inpatient and outpatient ultrasounds that he and his team have performed at STHS ER Weslaco, Eddie is honored to work at a facility that has touched the lives of nearly 200,000 patients in need.
Unfortunately, they see us at their worst, when they're not feeling that well, but they know that when they come here, they're going to get taken care of. I wear it with the, I guess you could say a sense of pride on my heart that I know that we're doing something good, and I'm glad that it's still doing great, and then the community's thriving and seeing the positive impact we're having.
For those who've entrusted STHS ER Weslaco to provide quality, compassionate care swiftly in their time of need, Eddie and the rest of the staff offer their sincerest gratitude.
They have to trust us, that we're going to be there for them when they need us, and I really think that for them giving us that trust, we should thank them. It's a great feeling to be able to do that.